We are the Medical Society Consortium on Climate and Health, a coalition of doctors and health professionals mobilizing support for climate solutions that will protect and promote health, equity, and resilience for all Americans.
Realize how this is really a unifying concept for public health, primary care, general medicine, emergency medicine, and disaster medicine.
It's now, it's urgent, and we got to alert everyone at home. We got to alert everyone in the community. We got to alert our politicians.
And if we all contribute just a little bit, it makes a big difference.
Hi, it's Madeline Petch. Let's talk about climate change, shall we? It's everybody's favorite topic. So I thought it'd be important to give you guys some tools and tricks on easy ways to reduce your carbon footprint. Let's talk about going plant-based. I've been plant-based my entire life, and it is such a great and easy way to help the environment. Now, I'm not saying to go fully plant-based, and a lot of people are very against that. However, if you had one vegan meal a day, you would reduce greenhouse gas emissions largely. You could have all of your friends do one vegan meal a day. You would be helping the environment so much. I don't think people realize how bad animal agriculture is for greenhouse gas emissions, honestly. So just think about it. It's really healthy, it's easy, it tastes good, it doesn't have to be disgusting, and it'll help the environment, and it'll make you feel better.
Great, thank you. Welcome, everyone. Special thanks to the team at Eco America for putting together this important discussion. Thank you to our very distinguished panelists for making time to join this conversation today. Most importantly, thank you to our audience for joining us to have this conversation. I am genuinely grateful and humbled to be present and able to moderate this important discussion. We are indeed facing uncharted waters, multiple crises and challenges, and looking for the opportunities in those challenges and crises to build a brighter future and make a difference. From the global pandemic to racism, injustice, economic troubles, and really the greatest challenge of human time, that of climate change, we are truly living in unprecedented time. I very much look forward to getting right into the conversation, but I just want to open with asking our panelists really just how they're doing today. Nicole is joining us from the Navajo Nation in Arizona, joining us by phone. How are you doing today, Nicole?
I'm doing well, thank you. I hope everybody can hear me. Just let me know if the sound isn't coming through good. I live out in the most rural area of the Navajo Nation, and out here it's like living out in the countryside where your nearest neighbor is about 2 to 3 miles away. So the pandemic is here on our reservation. The virus is here on our reservation, excuse me. But some of us are finding it a little bit easier to stay to social distance and to keep a safe distance away from people. We're not in the town areas, but it's something that has reached our relatives and relations, and it's been hard. It's been hard on us all. We have many situations here on the reservation that make something like a virus such as this really hard to deal with, such as the lack of running water in some places, access to water, those kinds of things. And I really think that the pandemic has highlighted, I think, the climate issues that we're having. And for us on the Navajo Nation, I think it's tenfold. because we have already been struggling so much to give ourselves an equal and level playing field with the rest of the United States. And now it's just that much harder with COVID and a lack of resources and a lack of organized response to the virus. And it's just even more challenging here on the reservation. So
imagine, thank you for sharing that with us. I'm here at my house in Madison, Wisconsin. Sacoby, you're in Maryland. How are you doing today?
I'm doing as well as can be. It's a very stressful time for me and my family personally. I have a mother-in-law who's actually in our house who's on a ventilator. So she's on a ventilator for 4 months. So, you know, when it comes to this pandemic, we've been very worried about people in our home bringing in SARS-CoV-2 because she's a high risk population, right, of losing her life. And now I'm from Mississippi. And so I found out recently that one of my nieces, you know, had COVID-19, and so I was worried about my mom and the rest of the family. So I think there's others like me who are, you know, who are stressed, who have family members who've gotten sick, who've recovered, family members who, you know, unfortunately lost their lives. And I think it speaks to the need for all of us to understand this pandemic, I think in a different way. To me, you know, this pandemic is 400 years in the making. I mean, we're really talking about a syndemic of toxic hate and racism, a syndemic of toxic pollution, a syndemic of toxic economic practices, plantation capitalism, as one of the architects of the civil rights movement said at John Lewis's funeral. And also, we're talking about toxic viruses. So that's in our country today. And it speaks to the fact that we have systemic racism and other factors that are baked into the walls of America. I mean, racism is as American as apple pie is. And so if you're going to address, you know, toxic hate and racism, toxic pollution, toxic viruses, toxic economic policies, and a toxic climate, we're going to have to deal with systemic racism. We're going to have to make sure there's policies that really empower communities. And we're going to have to make sure that we understand that this virus is made visible, the communities, the populations that we made invisible. So it's time for us to step up and do more. So from climate-19, but also climate change as well. So.
Well, thank you for sharing, Sacoby. Vanessa, where are you speaking to us from today, and how are you doing?
Hi, Tia. It's great to be with you. I'm coming from Miami, Florida. You know, I'm a journalist here at Telemundo Network, and for me, it's been very difficult. I think for all of us that are essential workers, especially when you talk about the news business, we have to be right there at the front lines, talking to the people, going out in our community, and reporting on the stories that are affecting, for us, the Latinx community. And it's been heartbreaking over the past couple of months because the Latino community have been disproportionately more affected by COVID-19. I mean, if you think about it nationwide, Latinos for 33% of the cases in the nation, and we are a little bit under 18% of the general population. I mean, we have disproportionately affected also by the financial situation. Latino unemployment almost reached 18% this year. And when you think about women, Latino women, almost 20% lost their job. And this is huge. And for us, for me personally, to talk about these issues that are affecting my community, or to talk to the people that are being affected, is really heartbreaking. Especially because you see that Latinos are essential workers. You know, I mean, they are the ones that are out there in the fields picking up our food. They are the ones that are packing our food in the factories and in the supermarkets. They are nurses and they are doctors, and many of them, they don't even have health insurance, or they don't even have the possibility to receive a stimulus check in the mail like many other people in America. So So it's very difficult, but at the same time, I'm hopeful that this difficult situation that we are all going through, at the end of the day, is going to come up to something good, and that we are going to be able to change and realize that that there is better ways to live, and hopefully that is what comes out of all this situation that we have been going through.
Experience for me going through COVID, caring for my mom in Maryland, and now being back in Madison is the sense of people's hunger for community, recognition of how important community, what an important role the feeling, the actual feeling of community is in our lives. And it's really put a heightened sense of value on that. It's been my observation, and which is an interesting and outcome. Nicole, I'd like to ask you, you've been working on the reservation, of seeing firsthand really significant impacts on the Navajo people from fossil fuels. We've been involved in an effort against Peabody coal. Could you talk to us a little bit about how fossil fuels has impacted the health, well-being, both from a health standpoint and environmental standpoint, on the reservation, the impact fossil fuels has had, but really your own story about the work you've done, and how I read something this morning about your work and referencing this idea that activism can take many forms, and you talked about the challenges and the opportunities of organizing and activating your community to fight fossil fuels in the Navajo Nation. Can you tell us a little bit about that experience through the lens of this moment?
Yeah, hopefully I can answer all those points. I think one of the things that I want to say about this point in time is that hopefully we are all aware of where our food and our goods come from, and how they're made, and who has to pay in order to get these goods to wherever it is their final destination. The other thing I want to say is hopefully we are all fully aware of how inadequate the U.S. healthcare system is, and how very useless big pharmaceuticals are, how unreliable they are at this time. The most basic resources are used to combat this pandemic and on the reservation. And one of the things that just came front and center for us is the water situation. And this is interesting because the water is the reason that our organization, Nizhóní Ání, formed in the first place. And it is because fossil fuel operations such as the one Peabody Energy operates on Black Mesa has used millions of gallons of precious drinkable groundwater on the Navajo Nation, almost free of charge. They pay 1/4 of a penny for every gallon that they use, and they have used to date 50 years now, millions and millions of gallons, billions of gallons of water. And here's the irony of it, is that the Navajo Nation that spans Arizona has no water rights. The largest indigenous nation in Arizona, whose boundaries include the Upper Basin Colorado River, the Lower Basin Colorado River, and the Little Colorado River, still has no water rights in Arizona. And when COVID-19 came to our reservation from the outside, our people could not understand how this virus spread and could not understand how to fight against it. And one of the things that outside healthcare professions told us is you have to wash your hands. It's key to keeping the virus at bay. You have to wash your hands with soap and water. Well, this is easy for people who have running water from a kitchen sink, a bathroom sink. Most 30% of our people, it is described in the data, some of the data that the Navajo Nation has, still has no running water. And I can vouch for my community. I'm one of those people that still has no running water. We still warm up our water on the stove and to use it to bathe and that kind of thing. Just, so this just hit us hard. It's like being hit in the gut by, a very hard blow in the gut, where we didn't have the very basic resources with which to fight this pandemic. I live in the high plateau of Northeast Arizona, and we have been fighting coal mine operation and the associated power plant for many years, over 20 years. And finally, August of this year, the coal mine shut down. And in August of last year, 2019, the coal operation shut down. And in November of 2019, the power plant shut down. It's been a long, long time. We finally are at this point where we are talking about transition. And one of the very basic needs for transition to happen successfully is water. And we have dedicated 50,000 acre feet a year to the power plant so that it could operate, and over 4,400 acre feet a year for the coal mine operation. We here on the Navajo Nation have basically stifled any economic development for 50 years, just so fossil fuel extraction could happen. And that cheap energy and cheap power could be delivered to central and southern Arizona, California, Nevada, so that the big cities could thrive there and enjoy cheap electricity and water. Part of the energy that's was generated at the generating station was used to divert water from the Colorado River into canals, and so that the water could flow into the cities of Phoenix and all of southern Arizona. And this is considered the biggest water project in the world, the most expensive water project in the world, and Congress had a hand in it. Today, we're sitting on the high plateau of Black Mesa, wondering how we're going to access our water that was used to grow these big cities in Arizona and California and Nevada. This is the devastation. And so when something like COVID-19 hits your community and you can't even wash your hands, this is a problem. And this is a problem of America. I just, I want to say that this pandemic has really shown us who America really is and the many faces of America. And I want to see a day when the people realize that we can't move forward like this by moving benefits from one community, resources from one community to another, only so for selected people to thrive and prosper and leaving others in the shadows. And that has been my journey to now. I'm very happy for the closure of the power plant and the mining. Many of our people have succumbed to black lung disease and other respiratory problems, and many people have been displaced from their lands. So I look forward to the future where we can better manage our resources, water namely, breathe clean air, free from coal dust and pollution from the power plants, and really reconsider how we harvest and distribute resources and goods, and do it in a way that is sustainable.
Yeah, that's great. Thank you for sharing that. And you, in the process of telling that story, answered one of the questions that came in from our audience. Travis was asking about some of the reasons behind the virus hitting the reservation so hard, and an obvious one is you can't even follow many people cannot follow the basic guidance of health officials for staying safe. So thank you for sharing that story with us. Vanessa, I'd like to turn to you for a minute. You know, at Noticiero Telemundo, you've covered so many fascinating stories, from Pope Francis, who has written extensively on the notion of creation care through the encyclical and a call to action on climate change, to Hurricane Maria, to COVID, to border detentions and presidential debates, climate change, and so much more. You were the first environmental investigative journalist for your organization, which is amazing and amazingly important. Can you talk a little bit about how you see the Latinx community thinking about the issue of climate change today? And in particular, I'm curious, when I look at the polling data, the Latinx community polls at a much higher, at a noticeably higher percentage of people concerned about climate change in your community. Can you talk a little bit about what you hear in the community and what your thoughts are on why the issue of climate change is something so resonant?
Thank you, Tia. Yes, I mean, absolutely. I think right now, and for the past couple of months, our life have been just all focused on this pandemic that we're going through, and with all the reasons, of course. But at the same time, what I see is that these crises have shown us the fragility of our society and the fragility of our system. And nobody thought that we could just, the whole planet will come to a stop because of the pandemic. Nobody thought that this could happen. So I think it's been a good opportunity for people to stop and reflect and think what we are doing wrong and what is not working in our relationship with nature. Of course, we are not living sustainable lives, and if we don't change the way we live, scientists have told us that the next pandemic will be around the corner if we don't start respecting nature and respecting animals and their ecosystems and the place on the planet. When you think about the Latino community, they are more concerned and they are more pro-climate because we are also disproportionately more affected by the impacts of climate change. So we know that when storm hit, we don't have the capacity to rebuild like other communities. We know that half of our community today lives in the 25 more polluted cities in the country. And our children, because of that, are more likely to suffer from respiratory illnesses like asthma. So we see the impacts of climate change firsthand, and therefore we are also looking forward for solutions, and our community is more likely to vote for legislation that is going to create these changes, to create sustainable lives, even if it means paying more taxes. So that is something that will literally give me hope. At the same time, I think this pandemic have shaken our roots of everybody in this country, not only the Latinx community, and it's a good opportunity to stop and what we need to change, how we need to start creating a new relationship with life, with nature, thinking about the priorities, what is essential for us and for our families, just rethinking the way that we're living.
Thank you so so much for that. Sacoby, you've been working for a long time, but quite vigorously of late on public health, and you've looked a lot at the impact of racism and injustice in its effect on the health of vulnerable communities. And I'll try to make this two questions. I'd like you to reflect just a little bit on the intersectionality of those issues. But there was also something that I saw this morning in looking at a TV interview of a while ago, in which you talked about the importance of citizen science. And that's an intriguing concept to me, because it gives an entry point to everyone and the non-experts to be part of a community concerned with and engaged in and on an issue. And we have this, we have a diverse audience from many regions and many situations. And I imagine that this would be an interesting thing to hear about how the average citizen might contribute to addressing some of the questions that you've been working so hard on. Can you talk about those things a little bit?
Yeah, so thank you for those questions. Man, I think when you think about the intersection, think about environmental justice, we're really talking about the intersection of race, class, place, hazards, vulnerability, and invisibility. A lot of populations that Vanessa talked about, Nicole talked about, as I said earlier, populations that because of our racist policies, our structured inequalities, they made invisible. Agricultural workers, brothers and sisters on reservations, people working in meatpacking facilities, folks who are healthcare, frontline healthcare workers, custodial workers, our transit workers, our folks who work in retail, right? 9 out of 10 of those most essential workers, right, are high risk of COVID-19. That's because they are part of the groups, as I said, this toxic plantation capitalism in our country. So they're forced to go out in these jobs and have potential of being in environments where they may have higher transmission rates of SARS-CoV-2. So when you think about, that intersection I talked about before, you can look at Flint, Michigan with the water crisis. That wouldn't happen in Ann Arbor, Michigan, right? You think about Dr. Bunyan Bryant sort of framing what environmental justice is. He talks about environmental justice is when people can go through life without experiencing the isms. We can have safe, decent paying jobs, access to recreation, communities free from drugs, crime, and violence. He talked about schools. Really, when we think about environmental justice, we're talking about the social determinants of health. So access to food, right? We're talking about not just food swamps and food deserts, but the reason why we have a broken food system is because of food apartheid in this country. Access to good jobs. We have economic apartheid, as I talked about before, plantation capitalism in our country. When we think about access to healthcare, there are many folks, if you look at, we know about Tuskegee, right? We know about, some of you may not know about some of the issues with women and when it comes to sterilization, women of color in the US, women of color in other countries, right? You also have to look at a lot of communities of color don't have access to health care. It's not good quality care, and it may not have health insurance. And then you get to this point of toxic pollution, right? Why is all the landfills, incinerators in communities of color, Latinx folks experience 125% more traffic pollution than whites. Blacks, about 7% more traffic pollution. So you think about mobile source pollution in communities of color, stationary source pollution in communities of color. Nicole said it herself earlier. She explained what's happening with the extraction and the benefits. I call that environmental slavery, where some groups get the benefits and other groups are internalized the environmental, social, and economic externalities, right? And so it's not only their ecosystems used as sinks for pollution, but literally their bodies are being used as sinks for pollution. So we think about climate change, we're talking about greenhouse gas emissions as well, and those co-pollutants. You can look at heat waves that disproportionately impact communities of color. Heat waves are hell for the vulnerable, hell for the poor, hell for the elderly, right? So you see those intersections. And your second question, citizen science is a way to see, how can you use science to empower folks? Now, I didn't say empower with EM, I said empower with IN. I can't give you power. I can help you use science to connect to the power that you already have. So you think about communities that are dealing with air quality issues. We're helping to build hyper-local air quality monitoring networks in communities that are impacted by pollution across the country. We have a network right now in Uniontown, Alabama, 20 miles from Selma. We're working with community groups down in Savannah. Nicole hit on this when she said again, goods movement, port communities. I've been working in Charleston, South Carolina since 2007 on looking at air quality issues. So the thing about citizen science is, and we really, to be more inclusive, that's called a community science. There's opportunities for those frontline and fence line community members to collect their own data. Because as a PhD, I'm a scientist, right? But you don't have to have a PhD to be a scientist. Anybody can be a scientist. And folks on the front line and fence line, they are the subject matter experts. Folks who live near power plants, folks who live near hydraulic fracturing facilities, folks who live near the oil and gas pads, folks been impacted by pipelines, folks where you have processing, folks who are dealing with the waste products like like a coal-fired coal ash, right? That's a landfill in Brandywine. Brandywine, Maryland is an unincorporated Black community that has several power plants and also a fly ash landfill right beside the only park in the whole community, okay? So you have this across the country. And Nicole said it again, you change the geography, you change the race ethnicity. But in this country, the exposure disparities are the same. The economic disparities are the same. The health disparities are the same. We have a problem, but the one way to address that problem is communities empowered through science, collecting their own data and translating that data to action.
Oh, that's great, Sacoby. Thank you for that. As climate change program director for the Outrider Foundation and someone who's been working in climate change advocacy for a really long time, I've spent a lot of time recently thinking about how to engage, inform, and inspire action among a broader community, like our, including folks in our audience today, how we can speak beyond the choir and grow the congregation, to use that metaphor. Obviously, if environmentalists could deliver us across the finish line, we'd be there by now, right? I've worked long and hard on this issue. And so I spent a lot of time thinking about messages and messengers, new messengers that can reach people that perhaps I can't. Each of you on this panel today are an important part of helping reach other audiences and be sure that people understand the impact on diversity of communities. And I think of my father's words on the eve of the first Earth Day 50 years ago was, ecology is a big science, not a narrow one. It includes the worst environments in America, in the inner cities and in Appalachia. It includes rats in the ghetto and public housing unworthy of its name. I think the environmental community has not, until recently, really heard or paid attention to that message. As well intended as we have been, we've been a pretty privileged and not particularly diverse group of advocates. And it's critical, especially at this juncture in American time, that we move beyond that way of thinking. And someone sent in a question here asking, what role national groups have in helping address these challenges. And it's something that I experienced a lot in my years at the Nature Conservancy, and this need and effort that well-intended people recognize to empower local communities to take action and pursue ideas and solutions and address challenges that are relevant to them where they are. And I guess I'd ask each of you, and I'll go back to you, Nicole, if you could briefly just speak to the question of how you think those of us who want to be helpful, want to be more effective, want to grow and diversify and strengthen the movement, what are your needs and how can we help? You're muted.
I'm sorry. Yeah, so this is one place where I'm very excited about this. There are so many advocates out there, and there are so many opportunities to find creative solutions. So this is actually, even though it's a challenging time, it's also, what I'm seeing is I'm seeing a lot of creative solutions coming out, and a lot of talk and new ideas that I'm just really excited about, and it makes me feel very hopeful for the future. One of the things I want to say is that here, coming from my perspective as an Indigenous person, a person who's lived on my reservation all my life, except for the few times that I left to attend college. But all my training, other than that, is back in my homeland on the Navajo Nation. I have worked hard with many people in my community and allies outside my community to organize our own people so that we have so that the very people who are fighting for their water and fighting for their land are the people that are impacted, and the people that whose grandchildren will be using those, for lack of a better term, resources in the future. We like to talk about elements of life on our reservation, on our homelands. But, you know, outside of that, I think there is room for everyone to take part in this. The marches and the protests that are happening now, hundreds of thousands more need to join. I know Indigenous people have been holding the front lines in many places across this nation where pipelines are trying to be built and dams are being built, and you know, more coal is being proposed. And our Black brothers and sisters are also have led a lot of these efforts, these protests. I want to see out there white women step up and really put their voices to this as well.
That's an important point, and I thank you for it, Nicole, and I deeply apologize for having to interrupt, but we have to go to wrap up here. I want to thank the panelists in Eco America. I want to thank our audience for tuning in, and I hope you continue to listen. There'll be conversations about solutions in sessions to come. I am grateful to all of you, and I think if I'm following Travis's direction properly, we don't have time for further comments. So I simply want to thank Vanessa, Sacoby, and Nicole for all of your hard work and for your contributions to the cause, and thank the audience for tuning in and listening. I really appreciate it. So
thank you, Tia. Thank you so much.
Thank you.